And now, the president of the International Federation of the Red Cross and Red Crescent discusses the plight of migrants and how, in the wake of COVID, inequalities and obstacles to accessible healthcare have become even more exacerbated.
We speak about COVID-19 as an equalizer, but this pandemic exposed and magnified even more inequality gaps in our society. The most vulnerable always pay the highest price, whether it is natural hazards, climate crisis, or health emergency, and of course, pandemics. The COVID-19 pandemic deeply affects the health and the economic well-being of people all over the world. And this pandemic has been cruel for all of us, but it has been catastrophic and particularly salient for displaced populations, including migrants, asylum seekers, refugees, and internally displaced persons, who disproportionately experience the impacts of the pandemic to their weakened social support structures, socioeconomic prospects, unequal access to healthcare and social services, precarious housing, tenuous living and working conditions, vulnerability to misinformation, risk of exploitation and abuse. And this is augmented for those in refugees settlement, in the camps, in transit centers, in immigration detention, in crowded urban spaces, where physical distancing and other protection measures are very difficult to observe. Migrants face formal and informal barriers to accessing services, and these hardships are exacerbated during the COVID-19 pandemic. Ensuring equitable access of migrants to health coverage and health services, including mental health, is a humanitarian imperative, and will increase the effectiveness of providing critical humanitarian assistance. Since April, more than 5,000 people have been rescued at the Mediterranean Sea or arrived directly at the Italian shores. All of them were taken to designated ferries for quarantine during the COVID-19 pandemic. And more than 300 volunteers and staff of the Italian Red Cross worked alongside the Italian authority to provide humanitarian assistance. COVID-19 testing, psychosocial support, provision of hygiene kits, food, PPI, and contact with families for those on board. The Italian Red Cross worked with the authorities to ensure that people have access to health services during the COVID-19 pandemic without fear of arrest, detention, or deportation. IFRC report least protected, most affected migrants and refugees facing extraordinary risk during the COVID-19 pandemic that was launched last week finds that the barriers migrants face include cost, inaccessibility of information, distance from a healthcare facility, unavailability of medicines and treatments, fear of deportation and detention, stigma, and discriminatory provision of care. Migrants and displaced persons, particularly those in irregular situations, often fear deportation and detention upon seeking public services. And governments must maintain health centers and sanctuary spaces in which patients' data is really protected. For instance, the Maldivian local authority established an agreement with the Maldivian Red Crescent to safeguard the data of migrant workers. Information collected at COVID-19 testing and treatment centers would only be shared with the Ministry of Health, and migrants' legal status would not be provided. With this firewall established, the Maldivian Red Crescent issued beneficiary cards, enabling migrant workers to participate in COVID-19 screening and contact tracing. Firewalls enable migrants to access essential health services without any fear of deportation and detention. Border closures around the world are leaving migrants stranded in an unsafe situation and often without access to essential services. In Chile, migrants from Bolivia are often stranded without access to work, social protection, or healthcare services. To support Bolivian migrants, the Chilean Red Cross offers basic health services, emergency shelter, and meal distribution to those camped outside the Bolivian consulate waiting for the return. And ensuring migrant access to essential services is crucial, lest we risk multiplying the future humanitarian case. Migrants often lack access to information on how to avoid, treat, and contain COVID-19. For instance, in South Africa, migrants from the Democratic Republic of Congo experience language barriers and digital poverty, preventing them from accessing public safety information. And the South African Red Cross works with different volunteers and staff to translate information and share it with migrant communities in timely and accessible ways. To mitigate the spread of COVID-19 for all, migrants should have access to timely, accurate, reliable, and culturally appropriate information in their own language. Further, as migrants often work in the informal economy, the lockdown and global recession risks are pushing migrant workers into extreme poverty. In Turkey, about 70% of a surveyed sample of refugees' families report loss of employment due to COVID-19. Inability to pay for healthcare services makes refugee families particularly vulnerable to the pandemic's health and socioeconomic consequences. To mitigate this, the Turkish Red Crescent and IFRC provide 1.7 million refugees in Turkey with cash assistance, and migrant access to social protection nets is vital. We all face heightened stress and anxiety in time of COVID-19. And for many women and girls, increased rates of domestic and sexual violence have deepened the mental health impacts of the pandemic. Survivors of human trafficking and sexual and gender-based violence in Sudan are facing further uncertainty with the suspension of the UNHCR resettlement program. The Sudanese Red Crescent Society is providing psychosocial support by carrying out community building activities in their safe house. And as mental health and psychosocial support are key components of the COVID-19 response, new and existing mental health and psychosocial services must be made available to migrants. In addition to consideration of humanity and fairness, it is in the critical national interest of every country in the government to ensure that testing, tracing, and treatment and future vaccination is rapidly available to all people living within their borders, or we face the risk of a second wave and renewed lockdowns. Ensuring migrants access to healthcare during the COVID-19 pandemic will lessen the current and future humanitarian caseload and a setting stone towards achieving SDG 3.8. This also provides us the opportunity to implement our pledge to leave no one behind. Implementing the 2030 Agenda in the face of the COVID-19 pandemic requires the safeguarding of migrants' access to healthcare services, especially vaccines, as well as to social and economic protection. No one will be safe until we are all safe.